With 3.5 million new pediatric COVID cases in January alone, the potential that shots could be going into very young arms within a month is welcome news for millions of parents.
Every day I'm worried about them contracting COVID. I would say that we're very cautious.
In Maryland, the Cross family has 3 kids, 2 under the age of 5.
As a working parent, I want them vaccinated so that we are not dealing with this child care gap of constantly having to have our kids out of school and daycare.
Pfizer today requesting emergency FDA authorization for a 2-shot vaccine dose at 1/10 the adult dose for kids 6 months to 5 years, as it continues researching whether a 3rd dose provides even more protection. Children typically receive 16 vaccinations from birth to 18 years, but many parents are hesitant to add another. A new COVID vaccine study finds just 31% of parents say they'd vaccinate kids under 5 right away. 29% will wait to see how other kids react. 26% will not vaccinate their youngest kids. 12% will only do so if the school requires it. Dr. Paul Offit is on the FDA's outside vaccine committee that evaluates safety.
We all want to see the data. And we would not approve this vaccine unless we could imagine giving it to our own children or our own grandchildren. I think the American public can be reassured by that.
Today, the American Academy of Pediatrics weighed in, saying it's important that all children can benefit from the protection that the vaccine offers.
The fact is, even if they don't get hospitalized or worse, they have to miss school, their families have to miss school. It's a major work burden. It ends up isolating the whole family, and it's an educational loss for a lot of kiddos.
And Tom, it sounds like in this case, the FDA asked Pfizer to submit the request for authorization. I suppose that suggests this is very urgent.
Yeah, that's right. It wants to consider a 2-dose regimen to get the ball rolling on building immunity before that 3rd dose is approved. So far, there have been no serious side effects reported in kids 5 to 11 who've been vaccinated, but fewer than 20% in that age group are vaccinated.